Hi, my name is Nichelli Squilicotti. In this video, we are going to go over what are the effects of fruit regarding diabetes. Throughout the video, we will cover what is diabetes and the different types, symptoms and causes of type 2 diabetes, preventions and diet, properties of fruit in the diet, evidence to prove if fruit is beneficial to preventing diabetes, and lastly, recommendations and summary. First, let's go over what exactly is each type of diabetes. Type 1 diabetes is an autoimmune condition in which the immune system attacks and destroys the insulin producing cells via the pancreas. This type requires insulin in order to survive by injecting it into the body. An individual with type 1 will have to take insulin shots or wear an insulin pump every day in order to manage their blood sugar levels. Type 1 is not preventable. It can appear at any age, but typically develops in young children starting at the age of 4 to 7 years old for the first peak and ages 10 to 14 for the second peak. Some symptoms include frequent urination, extreme thirst, dry mouth, fatigue, increased appetite, rapid unexplained weight loss, blurred vision, and slow healing cuts. Next is type 2 diabetes. Type 2 diabetes is a chronic condition in the body that develops slowly over time. Type 2 diabetics are referred to as insulin resistant. Unlike type 1, type 2 is typically developed in adults and is in fact preventable. When an individual has type 2 diabetes, this means that the body does not use insulin properly, creating high blood sugar levels that must be monitored. The insulin isn't used properly due to the insulin receptors being damaged through overuse of needing to regulate the blood sugar levels over time. The insulin acts as a key, meaning the receptors will not allow insulin through due to damage, which leads to high blood sugar levels from not being able to enter the cell. With the blood sugar remaining too high, this can lead to permanent damage to certain parts of the body, such as eyes, nerves, kidneys, and blood vessels. When someone enters a state of high blood sugar, it is referred as hyperglycemia, while low blood sugar is hypoglycemia. Having low blood sugar is just as dangerous and can cause an individual to lose the ability for bodily functions to continue, resulting in diabetic coma and death. Some causes of type 2 diabetes include high stress, pancreatic disease, high blood pressure, age, race, genetics, sedentary lifestyle, smoking, unhealthy foods, being overweight, and specific medication. Gestational diabetes is a type of diabetes that only develops when a woman is pregnant who does not already have diabetes. It is caused by a combination of genetic and environmental risk factors. Many times, when a woman develops gestational diabetes, it goes away after birth but has a higher chance in developing type 2 in the future. Every 2% to 10% of pregnancies in the United States are affected by gestational diabetes. Type 2 diabetes is found to be largely preventable with specific lifestyle changes in place. As demonstrated, the left side represents a lifestyle that will indeed have a much higher chance in developing type 2 diabetes. This includes living a sedentary lifestyle by not moving the body enough throughout the day, having a higher fat percentage in the body, and eating heavy amounts of fatty, highly processed refined foods. Foods to avoid include fried foods, alcohol, processed meat, white breads, and baked goods. However, the right side represents a highly beneficial lifestyle that would result in a much lower chance in developing diabetes. This includes exercising on a regular basis, eating highly nutritious diet, and maintaining a healthy weight. Now, it is very known throughout the world that fruit is very healthy and that specific fruits have many benefits for specific targets. For example, some fruits can target digestion, while others fight inflammation. Fruits contain a vast number of vitamins and minerals, but consist of mainly carbohydrates, which can spike blood sugar levels. So, how would this be safe for an individual who is suffering from diabetes and trying to regulate and maintain their blood sugar levels? Fruit is exceptionally high in fiber when eaten whole, including the skin and pulp. When a diet is high in soluble fiber, this can slow the absorption of sugar and control the blood sugar levels. Soluble fiber absorbs water and turns it into a gel texture, which protects the gastrointestinal muscles in the colon, whereas insoluble fiber stimulates the gastrointestinal tract, which is essential for healthy digestion. Both of these type of fibers pass through the body without elevating blood sugar levels and aids blood sugar control and insulin response. A study shows that replacing each 3 servings a week of fruit juice with the same amount of individual whole fruits resulted in a lower risk of developing type 2 diabetes. Consuming fruits such as oranges, peaches, plums, apricots, and more lowered the risk of diabetes. The evidence showed that there is an 18% lower risk for prunes, 11% lower risk for peaches, plums, and apricots. Blueberries was shown to have 33% lower risk. With switching the fruit juice with whole fruit, this incorporated more fiber since juicing strips the fiber from the fruit. Overall, it was found that a greater consumption of specific fruits is significantly associated with a lower risk of developing type 2 diabetes, whereas consumption of fruit juice is associated with a higher risk. Stripping the fibers from fruit by juicing changes the way the natural sugars in the fruit work in the body, making juicing not ideal for someone with diabetes. For example, drinking a glass of apple juice is more likely to have an effect on your blood sugar rather than eating a whole apple would. Eating a variety of fruit is essential and extremely necessary for maintaining a healthy blood glucose level. Fruits such as apples, avocados, bananas, blueberries, papaya, pears, plums, and more are amazing for the diet and high in fiber. Incorporating a diet with plenty of low glycemic fruits will not only help a diabetic live a happier, healthier lifestyle, but also help individuals at risk prevent from developing the chronic disease. Does fruit really help prevent the development of type 2 diabetes? Yes, it does. Consuming a serving of fruit in every meal will decrease a person's chances of developing the disease only if the diet is balanced all throughout. This means if a person is eating the fruit but also consuming a large amount of processed refined foods, then the benefits won't work entirely. The key is to consume more fiber-rich fruits while also eliminating processed meat, added sugar, fried foods, white bread, chips, and sweets. Fruit like papaya is shown to slow down the progression of diabetes, while blueberries is known as the diabetes superfood by helping the body process glucose for energy, increasing its sensitivity to insulin. And that is all I have for today's video. Thank you so much for watching.